In 1927, Austrian psychiatrist Julius Wagner Jauregg was awarded the Nobel Prize in Physiology or Medicine. He received this award for his discovery of the therapeutic value of malaria inoculation in the treatment of dementia paralytica, or neurosyphilis, which is the final stage of syphilis that causes severe mental illness. When Treponema pallidum, the bacterium that causes syphilis, remains in the human body for a long time, it eventually affects the brain. This leads to mental illness, mania, paralysis, and ultimately death. In that era, there was no medication to treat this final stage of syphilis, and it was considered an absolutely incurable disease. At that time, Wagner Jauregg observed a strange pattern. He noticed that some mental patients showed improvement in their mental state after surviving high fevers caused by other illnesses. Consequently, he decided to do something radical. He decided to artificially induce fever in his patients. Thus, he took blood containing Plasmodium vivax, the least dangerous type of malaria parasite, and injected it into patients suffering from syphilis. By doing this, the patient's body temperatures rose significantly, resulting in a high, burning fever. This extremely high body temperature killed the syphilis bacteria, Treponema pallidum. Once it was assumed that the syphilis bacteria were dead, the patients were given anti-malarial drugs like quinine to cure the malaria he had induced. Because of this therapy, about a quarter of patients with terminal stage syphilis completely recovered and were able to return to a normal life. This was regarded as a massive medical advancement of that era for a disease that previously had no cure. However, we must note that this treatment method was extremely dangerous. There was a risk that between 3 to 20% of patients could die from the high fever caused by the malaria itself. In the 1940s, after the discovery of the antibiotic penicillin, syphilis could be treated much more effectively, safely, and simply. Consequently, the malaria inoculation therapy was completely discontinued. Therefore, Wagner Jauregg's method stood as the best available treatment until the advent of penicillin.